The benefit is certainly that they can tailor this to really target those individuals who we're concerned about could end up in the hospital. The disadvantage is it does mean that we're going to have less consistency.
Manitoba's vaccine rollout set to reach its next stage as AstraZenaca arrival set for doctors and pharmacist clinics will be into arms soon. But patience, a key word here on Wednesday.
18,000 doses is not a lot to distribute throughout the entire province. In fact, we're looking at a range of between 50 doses to 200 doses, with some exceptions in the city going out to each of these clinics.
So for this initial rollout, much of the onus on doctors and pharmacists identifying which of their patients is most at risk.
They have all of the information about the patients that come in through that clinic, and particularly if they have an electronic medical record, they can search by condition in their record.
The eligibility, those 50 to 64 or First Nation individuals 30 to 64 with a range of serious health conditions from dialysis to cancer to Down syndrome.
So we have a lot of trust that they'll be able to do individual clinical assessments of the person who comes in to determine whether or not they meet the eligibility criteria.
Also on this list, those who are pregnant and have underlying risk factors.
There was nothing in any of the trials that showed any negative outcomes for the baby, for the person who's pregnant, and similarly, nothing that demonstrated any harm related to breastfeeding.
Reimer adding, like all of this rollout, they are flexible and ready to adjust as the data supports.
And as soon as we see any flags of concern, we can pull back and reassess.
The province has posted both the list of conditions that make an individual eligible in this initial rollout, along with a map showing the availability at clinics that, be forewarned, won't be plentiful at first.
Once we get big supplies coming in of AstraZeneca, that we'll be able to open it up much broader than just having a list of conditions that we realize is going to be confusing for some Manitobans to see themselves in.
While the province says deliveries for AstraZeneca are still up in the air, they do expect that number to grow substantially, and Manitoba also now expected to see shipments of Pfizer and Moderna take a huge jump in the coming days.
Well, it has doubled, and what we expect to administer with those is now about 120,000 doses from now looking 28 days ahead.
Manitoba also announcing the super site in Morden will open by March 22nd, and pop-up clinics soon to be appearing in a number of communities. Booking for both will be under current vaccine eligibility. In Winnipeg, Jonas Gilbart, City News.